Welcome back to Advanced Healthcare in Bits, where we break down complex medical and physiotherapy research into simple, practical knowledge. Today, we are decoding one of the most talked about rehab technique, blood flow restriction training, and its effectiveness in managing lateral elbow tendinopathy, commonly known as tennis elbow, backed by fresh scientific evidence. Can lifting a light weight can fix tennis elbow? Let's see. Before we begin, don't forget to like, subscribe, and hit the bell icon so you never miss an update on cutting edge healthcare research. Today's video is based on a randomized control trial published in Journal of Orthopedics and Sports Physical Therapy, which is indexed in PubMed and Scopus, high quality peer reviewed international journals. This article evaluates whether low load resistance training combined with BFR, which is blood flow restriction, can effectively manage lateral elbow tendinopathy, a condition that affects millions of people globally. Why this study is important? Lateral elbow tendinopathy or tennis elbow affects millions worldwide. It is seen in sports players like tennis and cricket, desk workers and housewives. Traditional rehab helps, but recovery can be slow. The highlight of the study. In this study, the research explored on whether low load training BFR can provide faster pain relief, better tendon healing, improved load tolerance, reduced stress on elbow structure, early functional return, and here's where it gets interesting. BFR allows patients to train at 20 to 30% of 1 RM yet achieve strength and hypertrophy comparable to heavy training without irritating the tendon. So that is low load and high output. The primary outcome used were pain intensity, patient rated tennis elbow evaluation, score for pain-free grip strength, global rating of change. The method of the study. There were two groups, Group A and Group B. The Group A was given low load resistance training with BFR, which is 40 to 50% of complete arterial occlusion pressure, and Group B was given low load resistance training with sham BFR, which is less than 20% of complete arterial occlusion pressure. They both received soft tissue massage, supervised exercise twice a week and for 6 weeks. Home exercise program which was continued for about 12 weeks. Session started with determining arterial occlusion pressure in standard anatomical position. One group was applied BFR with 40 to 50% of occlusion pressure and other with sham BFR with less than 20% of occlusion pressure. Two-stage training program was used. At first stage, all exercises were performed with 4 sets of 30 repetitions with 15, 15 and 15 repetitions with 30% of 1 RM of elbow flexion and extension. And for wrist exercises, 3 sets of 10 repetitions with minimum pain-free weight. The second stage started at least after 2 weeks of training, and if patient did not report pain during or after the exercise, then patient performed the first stage exercises along with additional exercises without BFR such as wall push-ups, wrist flexion extension with rubber bar, hand grip using soft ball, and standing rowing exercises. The home exercises were instructed to perform every second day. Here's what the research found, and as a clinician, you will love this. Group A showed significantly better improvement than Group B. They found significant reduction in pain, improved grip strength, which is the main function, better tendon adaptation, and lack of adverse events. Physiological changes that took place were BFR increases metabolic stress, which in turn activates fast twitch fibers that stimulates the growth pathways and enhances tendon and muscle recovery. Also, the mechanisms such as activated endogenous opioid system, recruiting high threshold motor units, baroreceptors pathway to increase blood pressure explain the result. So how can clinician apply BFR for tennis elbow? Here's a simplified protocol based on the study. Pressure should be 40 to 60% of arterial occlusion. Load should be 30% of 1 RM. Repetition should be 30, 15, 15, 15 pattern. Rest should be 30 seconds per set and a frequency should be 2 to 3 sessions per week for about 4 to 6 weeks. With proper cuff placement and monitoring, BFR is safe and extremely effective. So check given safety checklist while application. So the final takeaway, BFR along with low load resistance training is an effective treatment for lateral elbow tendinopathy. It reduces pain, increases strength and improve function. It is safe, practical and easy to implement in physiotherapy setting. I have pinned the full research article link in the description so you can check it. If you have any question or want help interpreting other research papers, drop your queries in the comment. Also, want a full detailed video on BFR technique? Drop comments or tell me what topic you want me to cover next. Your suggestion might be our next video. Thank you for watching Advanced Healthcare in Bits. Don't forget to like, share and subscribe and hit the bell icon for regular scientific updates. See you in the next video. Stay healthy and stay informed.